Strategic Studies, Islamabad. I would like to welcome all our honorable speakers from around the world. And the reason that we have gathered today is to share whatever is happening around the world, and we would request all of you to please share whatever is happening in your country, how the preventive measures are being taken in your country, and also advise us and others what should be done once to counter this pandemic. We have speakers from Turkey, we have from Moscow, we have a speaker from Azerbaijan, from Saudi Arabia, from Pakistan, and from other countries also. So we will keep on asking you, and we will keep on interacting with each other in future also. So for formally starting the session, first of all, let me introduce myself. My name is Khalid Taimur Akram. I'm the Executive Director of the Center for Global and Strategic Studies. Before we hand over to our foreign speakers, I would like to invite Major General Khalid Amir Jafri. He is the President of Center for Global and Strategic Studies, to please speak.
Thank you, Khalid. Assalamu alaikum. A very special welcome to the analysts and experts from Turkey, China, Saudi Arabia, Russia, Azerbaijan, Sweden, and other countries. COVID-19, as we all know, has really taken the world by surprise. Its rapid spread and devastating effects were or are unprecedented. And this has thrown the entire global healthcare system in a state of imbalance. Nearly all the countries, from the global power centers to the smallest country, has been affected. No solution as yet appears to be in sight, at least for the foreseeable future. The effects of this COVID-19 are still being analyzed, and there are many. Some have come to the surface, but others have yet to come to the surface, and they may take some time to be visible. And these effects are in various spheres, not only confined to the healthcare system. The UN Secretary General, I think, is spot on when he says that this is the gravest test since the founding of this organization, which is the United Nations, with governments already struggling to address rising unemployment and economic downturn. He also says that the pandemic poses a significant threat to the maintenance of international peace and security, potentially leading to an increase in social unrest and violence that would greatly undermine our ability to fight the disease. So, gentlemen, in such times of crisis, as we all know, there is always a silver lining also, and an opportunity. An opportunity for the world to be united on some issue at least, the ability to have increased communication, to exchange best practices and to learn from each other. This conference has been organized with this in mind, gentlemen, to precisely learn from each other and to see what other spheres of cooperation can we go into, and so that we benefit. There's a mutual benefit involved in this. So I will not hold you up much longer. I will hand you over to the conference, the rapporteur, Colonel Khalid. Thank you very much.
Thank you very much, sir. And before we go to the foreign speakers, we would like to tell you that whatever is happening in Pakistan and how Pakistan is countering COVID-19. Fortunately, the fallout in Pakistan is not much, thanks to the help of our Chinese brothers. They have been with us throughout, and we are getting a lot of knowledge from China, from Turkey, from all our friendly countries to counter this COVID-19. So first of all, we would like to tell the situation in Pakistan and the measures which the Pakistan government is taking. So I would now like to invite Brigadier Mansoor Saeed. Let me introduce you. Brigadier Mansoor Saeed is a member and advisory board member of our think tank, and he is also part of the initiative of the government of Pakistan, which our government is taking to mobilize the public. So Brigadier Mansoor Saeed.
Thank you, Khalid. Thank you, everybody. Ladies and gentlemen, Assalamu alaikum and very good morning to everyone. It's my great privilege and honor to be part of this conference today. And what I'm going to tell you is, I will just very briefly give you the statistics so far in Pakistan affected by COVID-19 and what major decisions or initiatives the government of Pakistan has taken so far. And then I would also like to touch upon what are the likely outcome or how we see that this pandemic is going to affect Pakistan in future. So this COVID-19 pandemic was confirmed to have reached Pakistan in February 2020. It was on 26 February that Pakistan confirmed its first 2 cases of the coronavirus, and both these cases of patients, they had come to Pakistan from a neighboring country, Iran. So they carried it from another country. As of today, the statistics as per the government of Pakistan, the active cases so far are 4,736. About 300 cases in the increase in the last 24 hours. So far, the total detected, you can say, the cases of coronavirus, they are 6,505. Out of these, about 1645 patients, they have recovered from this disease. And unfortunately, we had 124 deaths due to this pandemic. We have about 50 critical patients as of today, and so far tests which have been conducted in Pakistan, they are about 75,000 tests conducted. And about as far as these statistics, the local transmission. Initially the this disease that came into Pakistan through travelers people coming from Saudi Arabia, coming from Iran, coming in or traveling in from Europe. So they carried it. Then thereafter, as the disease has grown in Pakistan, the estimates are, the calculations are that 55% of the present cases or detected cases in Pakistan, they are due to local transmission, and rest of the 45% are from the foreign travel. So Pakistan so far has about 588 hospital facilities which can take care of this disease, and we have 352 places earmarked as quarantine, which can house about 20,000 people as of today. So as the day is passing by, and we all know that it came as a surprise, as General Jaffrey also said, and no government in the world was prepared for this. So with every day passing, the governments are trying to improve upon their health maintenance system, and especially to prepare for this deadly virus. Whatever I have told today, tomorrow the government is trying to improve upon all aspects. There is a fair calculation done by the government of Pakistan, and it says that by 25th of this month, the cases, the confirmed cases, could reach up to 50,000 level. So that's worrisome. Now, for my foreign audience, it would be for their knowledge that in Pakistan, the health is a provincial subject and not the central government. It's not the federal government subject. But however, the sensing the severity of the pandemic, the federal government in the month of March took a decision and started controlling and guiding the provinces on this, and also implemented some of the, taken some of the decisions and implemented them. We all understand that for a country like Pakistan, it has, or rather for every country in the world, this has two extreme ends. The coronavirus, it has on the one side is the health, it's disastrous if we let it loose. On the other side, if we go for a complete lockdown, or if we go for very stringent measures, then it's a economic death on the other side. So the governments have to wait very sensibly. So this was about the statistics. As anywhere in the world, Pakistan also initiated some steps to control this virus, control the spread of this virus, closing down of airports, then closing down the transport, public transport, traveling, along the, asking the people to go for the social distancing measures, precautionary measures, inter-provincial movement, intercity movement, that was stopped. Then the public was being advised to stay at home, stay locked in. So such like thing which almost in every nation what has been done. In Pakistan, we did not go for a complete lockdown except for few areas, selected areas, maybe streets or some locality, and that too for a few days, and after the clearance, those would also be opened up. So these were those rudimentary steps that were taken by the government of Pakistan, like any other country. Then in the mid of March, on 13th March, the National Security Committee, a very high-powered committee in Pakistan, involving both the top military and civil leadership under the chairmanship of the Prime Minister, that was held to review the situation, and it took certain decisions. It mainly was that National Coordination Committee for this COVID-19 was formed, it was established, and it has been established after that. Then National Disaster Management Authority, already a functional department of the government of Pakistan, that was asked to lead the operation and coordinate with the provincial and district authorities for the necessary implementation of the preventive and curative actions. All schools, colleges, universities, public and private places where there could be a gathering, villages or otherwise. They were already stopped, but this committee also took a decision to stop them for next 15 days, and after every 2 weeks or so, the situation is being reviewed and decisions are being taken. One important aspect that the government of Pakistan, the Prime Minister of Pakistan announced, and that was an economic relief package. It was on 24th March that he approved $8 billion economic relief package for the poor people of Pakistan. Excuse me. As you all know, that Pakistan is a developing country, and for the past few years has been undergoing economic crisis and was trying to come out of it, and this pandemic struck all of a sudden. So in this particular economic situation, giving or announcing a relief package like any other European or country or America or any other developed country, it was very difficult. So still $8 billion economic relief package has been announced. One thing I would like to share with you that in this relief package, there was an option to help the people in kind, give them rations, food, and if that was to happen, then again, people would have to, in a big majority, gather at some places and spread this virus. So it was the decision was taken at the government level that this money will be sent to the money. In fact, instead of kind, the cash would be sent to the people at their homes. The government through Retd income support plan, we already had the data, so that was used, and about 12.5 million people or families, they are being benefited out of this economic relief program. The program is still going on, and it is almost in the middle of it.
Sir, your time is finished. Kindly shorten up.
Yes, but I'm on the. So another thing that the government of Pakistan announced was that was the creation of Corona Relief Tiger Force. Now, gentlemen, this program announced is in the sensing the severity of the epidemic or pandemic in the coming days. Nobody knows what's going to happen after 1 month, after 2 weeks, or after 6 months. So if the situation goes towards the worst, so this is the force based on the youth or volunteer force that is being formed in Pakistan, so that when it comes to the worst condition, at the government has a volunteer force which can help the civil government and the civil administration in performing their duties during those hard times when maybe we have to go down to the controlled, to the complete lockdown. So this force, its registration process is just going on. SOPs are being made, and the general areas where this force is going to be employed or used would be something like sealing of the certain badly affected areas, management and establishment of local quarantines, identifying the COVID-19 patients in their areas, and helping the civil administration, maintenance of law and order situation in support of the civil and military setups. So generally, all sorts of support that can be rendered to the civil administration in controlling this, that is going to be done by this force. So as I said, the SOPs are still being formed, days or maybe in a week's time, the things would be established and shall be on ground. So this is what all I had to tell you people, and later on we can clarify if there are any doubts. Thank you, Khalid.
Thank you very much, sir. And now I would like to invite our friend from China, Professor Zhu Wenghong. Let me introduce you, Professor Zhu. Professor Zhu is Deputy Secretary General of Belt and Road Center at China Academy of Sciences. He's also Associate Professor in Institute of Russian, East European and Central Asian Studies at the China Academy of Social Sciences. Professor Zhu, kindly, all of us want to know that how China contained everything and what is the situation right now in China. And after Professor Zhu, we will have our honorable friend from Turkey after Professor Zhu. Yes, Professor Zhu.
Okay, thank you. Thank you, Khalid. Now, when you're talking about the COVID-19, I just want to say, let us just imagine three scenarios. The first, the pandemic will be effectively controlled in the next 3-4 months. The world economy will fall into a temporary structural depression, and the recovery will take 1 to 3 years. The second scenario will be the vaccine cannot be developed successfully in a short period of time. The epidemic's impact will last for several years, and the international order will be disrupted. It will take 5 or even more 7 years, even longer, to restructure the world economy. Third, the third scenario, the impact of the epidemic might far beyond our imagination, and the degree of the impact is related to the rise and fall of civilizations. After the pandemic, there is a recovery problem. Only how to build a new world order and new civilization. After many years, when we talk about looking back to this period of time, we will find it's only a small chapter in a big novel. Now we have noticed that the pandemic has been effectively controlled in China. But in the other countries, it's just started to outbreak. For example, just like in India, Bangladesh, African countries, Latin American countries, the focus now in China is the war against an epidemic has been shifted to the prevention and control of overseas epidemic imported cases. Next, China's economy should also to prevent the imported depression. So the new Great Depression has basically become a consensus. The only problem is how deeply the depression might be. Obviously, the longer the epidemic lasts, the deeper the global economy will fall into crisis, and the longer the recovery period will be. So the epidemic hit many countries, regional crisis level. Second, the epidemic will have a long-time impact. Third, the damage will be far beyond our imagination. So in the situation of the epidemic in the United States is more difficult than in China. The epidemic in the US is more eventually disrupted in all states. Unlike in China, it's basically only in one province and in one city. All the industries related to the pandemic will be the air transport, tourism, oil and other industries will be the most affected industries. Also, this time in the US, Canada, and many other countries stopped to accept tourists anymore. there are more serious contraction in trade activity. All kinds of demand are in the state of contraction. The impact on human development will be comparable to that of the World War, which means a major reorganization of the international order. Economic depression makes the world into a state of isolated island, and the globalization turns from shock to dying. As the pandemic continues, major Western economy will fall into a state of shock, and the social unrest, such as beating, smashing, looting, and burning, will spread. Accordingly, part of transportation and logistics must be restored, and these forced measures will bring the risk of further development of the pandemic and prolong the impact of the circle of the epidemic. The credit of the US dollar is based on the buying things in the American market. If the American market is shrinking dramatically or even doesn't exist, why do the assets in other parts of the world have to be denominated in dollars? People will take the institutional advantages of each country more seriously and reform next governance mechanism and the new framework of global governance. Yes, we know that the virus has been decreasing, but herd immunity needs more time and more deaths to create antibody. The death rates are too high that the Chinese government cannot tolerate. There must be a lot of people will eliminate in the context of the herd immunity. Who wants to be the next one? So that's my basic idea, which I want to share with you. Thank you.
Thank you very much, Professor Zhu. Now we will go to Turkey, and from Turkey we have Madam Beljan Koskan. She is specialist of infectious diseases and clinical microbiology, and she is currently working in Ankara City Hospital. Madam, welcome from CGSS, and we would request you to tell us the situation in Turkey, and also since you are the specialist of infectious diseases, guide us that what measures can be taken. Over to you.
Hi, welcome. I'm Belgin Coşkun. I'm joining this conference from Turkey. As you know, who has declared SARS-CoV-2 virus on 7 January. And in Turkey, the Coronavirus Scientific Advisory Board has been set up by Minister of Health on 10 January. The board consisted of the members specialized in chest disease, infection disease, and clinical microbiology at first. But later, the number has increased to 38 with the joining of expert academic in virology, internal medicine, and intensive care medicine. The board works out guidelines for the treatment by medicals and measures to be followed by public and update them in context of the disease course in the country. Almost every board member is invited by television, radio, and newspaper to inform and warn the public about the coronavirus and personal protection, as well as to prevent information population in the social media. Board members meet 3 times a week with health minister and report directly to the government. Our strategy on this pandemic is social isolation, early diagnosis, and early treatments. So that on January 24, 10 cameras have been installed at the airports Passengers arriving from China have been subject to additional screening, and passengers who showed the symptoms of coronavirus infection have been quarantinated. In the following days, the additional screening procedure has been expanded to include all countries that have reported a high number of confirmed cases. In terms of other measures in the airport, infrared guns, disinfection at all custom gates, pre-surgical mask and instruction leaflets have been handed out. On February 1, Turkey decided to cancel all flights coming from China. This was followed by the cancellation of flights coming from Iran, Italy, South Korea, and Iraq. And on March 28, all flights to other countries can be cancelled in order to prevent any health problems that could arise by traveling. The border with Iraq was also closed on 29 February, and a hospital was established near Iraq and Iran borders. People who came to Turkey from Iran and Iraq have been quarantined in there for 14 days. During March, it has been mandatory for all people coming from abroad to Turkey to be quarantined for 14 days. Staying at home for 14 days has started just an advice at first, but then it became mandatory for people to stay in quarantine either in hospital, hotels, or dormitories. People in quarantine have been visited by a doctor every day. Corona PCR has been performed on these people on 1st, 7th, and 14th days. And if there was no symptom of coronavirus infection, these people have determined to be negative, and they have been sent to their homes. Local administration have carried out massive disinfection work in public places and mass transit vehicles. It has started in Istanbul, and then the other cities have decided to install hand sanitizers at bus station. And on March 11, the first coronavirus case was confirmed in Turkey. He was a Turkish man who had conducted the virus while traveling to Europe. People who returned from Umrah were quarantined for 14 days, as there was a positive case in one of the people who has returned from Umrah recently. When the number of confirmed cases increased to 5 on March 12, all schools were closed, and education is supported with interactive education program with internet or education programs on TV by the teachers. On the first time, the location of the cases have not been declared because the government was afraid of the possibility of interstate travels. But after the virus has been spotted in all cities of Turkey, Health Minister declared the number of cases of each city, and interstate travels have only been allowed with the permission of governors. Minister of Justice announced that meeting in all open and closed prisons, the use of family meeting rooms and transfers between prisons have been prohibited. Minister of Culture and Tourism announced that all libraries, pavilions, discotheques, bars, nightclubs were closed. Then mosques, cafes, restaurants, and gyms have been closed, and all sports leagues have been cancelled. And all kinds of scientific, cultural, and artistic meetings or activities were postponed. Even though Istanbul is a folk city, our hospital is even enough for Istanbul, but government has decided to set up 2 more hospitals. Pandemic hospitals have been determined in all cities patients who have got chronic diseases were warned that they must not go to the hospital for elective controls, and they should take their drugs from pharmacy without seeing doctor. Families of infected people are quarantined for 14 days and are tested with COVID PCR, so that they are able to take new case earlier and block the spread of coronavirus. Healthcare people are being put into guest house, hotels, and hostels if they prefer, as they are afraid of their families and they do not want to go home. A full curfew has been put in place for those under 20 or over 65 years of age. And in the last Friday, a curfew has been put into place for all people just for the weekend. Most of companies have told their employees to start working from home. Mass transport vehicles are carrying this passenger while following social distance rules. Also, it is mandatory to wear a mask in the mass transport vehicles, supermarkets, and workplace. Masks are handed out to people for free by the government. At first, there are 5 test centers for COVID-19, but now we have got 73 test centers at Turkey, and current daily test number is 34,000. As a result of all these measures, current number of total cases is 69,392. Current number of people who have been treated is 5,674, and people who are in intensive care unit is 1,820, and current number of people who are extus is 1,518. Thank you.
Thank you very much, Madam. And at the end, we'll have some questions for you also. And now I would, we have our senior with us from Sri Lanka, Admiral Jayannath Columbage. He is the former Chief of the Navy in Sri Lanka, and he has always been very kind to us, and he's also part of our think tank. Sir, welcome from Pakistan, and we would like to know what is the situation in Sri Lanka and what the Sri Lankan government is doing, sir.
Okay, good morning, good afternoon across the world. Thank you very much for inviting me to be part of this video conference. This impact all of us. It is not selecting a country, race, or a community. This impact the whole world, and therefore I think it's very timely that because we are not supposed to meet right now, so we do this kind of things and keep the discussion going. So let me quickly brief you about the situation in Sri Lanka. And if you know, the first case of coronavirus in Sri Lanka was in January, and that was a tourist. But luckily, we detected her, identified her, tested her, treated her, and that story ended there. And from January until now, Sri Lanka had only 233 COVID-19 positive cases. Now, out of these 233, already 63 cured and gone back. Sadly, 7 people died. So that brings us to the total as of now 163. Now, last week or so, all the cases which became positive did not come from the society or the community. All the cases during the last 7 to 8 days came from our positive identification. That means either from the quarantine centers, or we suspected them to be having contact with a corona patient. So that, I think, is a very good sign, and this is a clear indication that in Sri Lanka we have prevented this going to the community transmission level, because still we are maintaining at the family, the close family or the immediate vicinity level. It has not gone to the community transmission level. So we can be very happy about the progress that we have achieved, having had this virus since the month of January. Now, one of the good things, I even heard about how Pakistan appointed a task force. Now, in Sri Lanka, in the month of January, an action committee was formed under the Ministry of Health. It was not a military response immediately, it was under the Ministry of Health, and it consisted of all the expertise in the field of health and field of aviation and field of shipping. Now, this committee was expected to give advice to the president. Now, much later, towards the month of March only, this action committee was elevated to a task force. Now, the action committee gave all the recommendations while monitoring the situation in the world, and it really helped the president and the decision makers to be very firm and to be very proactive. Now, even long before the World Health Organization declared this as a pandemic, Sri Lanka was ready, all our airports were ready, the seaports were ready, and that is how we started, testing people. We started detecting people at our airports much before the World Health Organization came out and declared this is a pandemic. So this, I think, is a very good lesson for, all of us to share, right? Now, another plus point we have in Sri Lanka is, which is not there in many developed countries, is the public health system. Now, we not only have the hospitals and the private doctors, we have a very strong, I know in Pakistan, I think this public health system is quite effective. I have read about it, especially preventing dengue and other communicable diseases. I'm sorry, I don't know about all the other countries. So we had a public health system where every citizen, rich or poor, is coming under the purview of a public health inspector. Now we utilize that system for contact tracing, contact identification, contact testing, and contact treatment, right? So that, I think, worked really in favor of Sri Lanka, the public health system. Now, another thing we did is, while we were getting ready, while the whole world started talking about the Hubei, Wuhan province, because China gave us the indication that it is there and they took control measures, be ready. And I think Sri Lanka is one country which got ready while before it became a threat to Sri Lanka. And not only we got ready, not only we had the airport covered, we prepared quarantine centers in the country, and that, of course, done by our great army, right? We prepared quarantine centers to accept the visitors to this country, send them through quarantine and observe them. Now, nearly, even now, out of this 233 figure, nearly 40% of our cases actually came from the quarantine centers. That means we identified them, grouped them, kept them in quarantine while observing their temperature, while checking, and then when we test them, like 7 to 10 days, and then they become positive. Not everybody, but they became positive. So that quarantine center, setting up quarantine centers at a very early stage of handling this COVID-19 was another plus point. Then the third one is getting ready with the medical supplies. You see, this is a new virus. Sri Lanka was not ready even to test. we did not have a single PCR test carried out in the month of January. But now we are able to test at least 1,000 suspected cases per day, right? So we had a lot of, we brought many things, even because this is a pandemic, even the countries which manufacture these testing equipment, the PCR test, the swabs, everything, they could not give it to the others, right? So we developed this, and right now we are very good. And also, very briefly, we did not go for a lockdown because a lockdown is impossible in a country like us. People have to eat, people have to take medicine. We went to curfew. Of course, we closed our border. We shut down the schools. Then we went to a curfew, and then we identified, we did a contact mapping. We took the whole country and we identified where the clusters are. Then we declared them as high-risk districts, and the other districts were low risk, and we stopped the movement between districts. And therefore, we could really contain it within the clusters, within the high-risk areas. And now I'm very happy to say that we are in the process of locking ourselves out. Now we are working on a exit strategy, and by inshallah, as the God's mercy, we should be able to come out with the exit strategy by the end of this month. And we should be trying to get our economy back, and schools back, education back to the fore. And it should happen because we are quite confident that we have kept this under control. Now, that's a good thing. But you see, having said that, we alone cannot do it in here. I mean, imagine that the situation in the country becomes okay, and then we are out of the virus, but then we want the rest of the world to come out of it. Then only, we can start working together, moving together, carrying out business together, getting our economy resurgent again. So we really want the whole world to come out of this virus. And I think one message is, I think from our Chinese scholar also, I think we should take it seriously, and we should never lose our guard. We should not be complacent and say, oh, everything is okay. No, there is a possibility of a second round, another surge. So we have to be really mindful. So as I have taken 6 minutes, I think I will stop here, and then I will be available. So you may have to pardon me towards the end because I have another commitment in the task force, and I'm happy to be with you.
Thank you very much, sir. Thank you very much, sir. As we all know that the media plays a very important role in containing the pandemic. In Pakistan, we have a very big presence of media, and the Pakistani media is not only helping the government in containing this pandemic, but also it is playing a lot of role in educating the people. So now I would come to Pakistan, and after Pakistan, we will go to Russia and talk to our Russian professor. So in Pakistan, I would like to introduce you Mr. Amir Ghori. Mr. Amir Ghori is a professional journalist and has a experience of last 30-35 years in journalism, and presently he is the editor of Pakistan's largest newspaper, which is the News International. Mr. Amir Ghori.
Thank you, Khalid. Good morning and good afternoon, wherever you are watching us. We know that, we are living in very interesting times, very tricky times, and we're trying to understand, where we have started and where we go. And when I was listening, I am really learning from the Sri Lankan experience and the Chinese experience and important messages which are coming through, and from the, our Turkish friend. Let me tell you very briefly, how media is working in Pakistan. I think it can be very easily described that we are working on a threefold operation. Like, for example, the first would be creating a bridge between the government and the people, the citizens who are watching us, about various steps being taken to combat the disease, and also letting the government know what people are telling us, so that, whatever, their problems are, whatever they are facing, we are creating an interface between the citizens and the state. Uh, and as we know that Pakistanis are not only living in Pakistan, almost 9.5 million Pakistanis are working all over the world. We are trying to connect their problems with, the government of Pakistan, the stranded Pakistanis, whether they are part of a very large workforce in the Middle East, or whether they are permanent citizens in many countries in Europe or North America, whether they, and also if they are now residents of those countries but stranded in Pakistan. So we are trying to connect, not trying to create a bridge not only between the Pakistani government and Pakistani citizens, but Pakistanis who are now, whether they are Pakistani Americans or the Pakistani British or the Pakistani French or whatever, between them and their governments. That is also being done through media, and we have some success stories where, we have even really resulted in government action. Like, for example, yesterday, the government of United Kingdom has conveyed to us through media that they will be picking up Pakistan, almost 7,000 British Pakistanis who are in Pakistan and back to their country. And also, we are letting the government know the necessary items which people are telling are not in the markets. We are telling them as helping the government know, because I know that our the former friend Brigadier Mansoor told us about the Tiger Force or other government arms which are working, but we are also letting the government know what we are knowing from the market and the street, what problem they are facing. Second would be talking to the subject specialist. Like, for example, now if we are discussing here, we will be reporting it in our newspaper and also in television. What the global experts are saying, how different people in different countries are combating. They are definitely at different levels of at tackling this disease. Some have already, like the Chinese friends, have told that they have not only gone through it, controlled it, and just now I've actually heard from our Sri Lankan friend that how they have not only saw the disease coming, got prepared, and almost controlled it. So we are speaking to subject specialists here. Let me tell you that almost 13,000 Pakistani doctors are working in the British National Health Service. Similarly, almost 13,000 Pakistani doctors are working in the American health system. So they were definitely working on much advanced, health systems. So we are talking to them. So they not only our people know, how they are dealing with the disease, but also you're helping the government. So trying to create that bridge, talking to subject specialists, how this disease can be effectively combated. And thirdly, lastly, keeping the people informed about what actually happening in the world, showing what the effect and impact it can actually have on the public, and also telling the government that some of their actions, some of their orders are not listened to by the people. Pakistan is a society which is a high-end society, the rich society, the middle class, and the very poor people, and their problems are not the problems of the elite. So, for example, elite can stock things at home and then they can quarantine themselves, but no, poor people who are working in the the daily markets, the daily wage earners, they are the worst sufferers of it. And we are also letting the government know that, listen, if these people are not listening to your orders, they are not ready to be curfewed, they are not ready to be quarantined. So they need to be understood, and they need to be dealt with not with a force but with an understanding. And as my earlier Pakistani friend told us that Pakistan is working on double system, the central government and the provincial government. Now media is trying to basically bring all those segments together, where these provincial governments and the central government can work, know what the people are saying, and also let the people know that this is for their benefit. If the government is facing this difficulty, if they are facing this difficulty, they are not alone. The whole world is facing this difficulty. This is a new scenario, and they will need to learn from this experience, I know sadly many people will lose their lives, which is a very sad part. Many people, I have friends and I have family members who have been tested, gone into the quarantine, and some have come back, and some of my friends have already lost their lives. So I know it's difficult times, but we are learning and trying to kind of basically keep our viewers, our readers as informed as possible of the global scene, of the national scene. Thank you very much.
Thank you very much, Amir. You gave a very comprehensive overview of whatever is Pakistani media is doing. Now we would go to Moscow, and in Moscow, our friend Professor Leonard joins us. He's basically from Moscow State Institute of International Relations. Sir, welcome, and we would like to listen whatever is happening in Russia and in Moscow.
Thank you very much for inviting for this international online conference. Yes, I'm Leonid Gusev from senior leading expert from Moscow State Institute of International Relations, and I want to brief about situation with coronavirus virus in Russia. Yes, the first cases of coronavirus pandemic were confirmed in Russia on 31st of January this year. Earlier prevention measures included restricting the border with China and extensive testing. Later measures after the infection spread from Italy on the 2nd of March, including cancelling events, closing schools, theaters and museums, shutting the border and declaring a non-working period. By the end of March, lockdowns was imposed in the vast majority of federal subjects, including Moscow. Yesterday, on the 15th of April, there have been 24,490 people in Russia who were infected. 1,986 recoveries, 198 deaths, and over 1.5 million tests performed. I should say about several words about economic impact. On the 20th of February, Minister of Finance Anton Siluanov says Russia is losing about 13,340,000 dollars each day because of decreased trade with China. As a result of the pandemic, factory output and transportation demand fell, bringing overall demand for oil down as well and causing oil prices to fall. This triggered an APEC summit in Vienna on the 5th of March. On the 17th of March, First Deputy Minister of Transport of Federal Air Transport Agency, Alexander Neradko, said cancellation of international flights during the pandemic threatens to bankrupt multiple Russian airlines. Russian airlines lost estimated $16 million due to the cancellation of flights to China in February. According to Minister Neradko, airlines could lose in our 100 billion rubles. It's maybe million dollars in revenues by the end of this year. On the 23rd of March, Russia's federal list of systemically important companies was expanded to 3 times, featuring about 600 businesses. According the updated list includes new airlines, Russia, S7, UTair, airports, Moscow Domodedovo, St. Petersburg Pulkovo, grocery chains, fast good chains, McDonald's, Burger King, and so on, and retail shops. On the 24th of March, Mayor of Moscow, Sergei Sobyanin, used orders to support business, which include postponing payments on organizations' property and land taxes, differing rental payments, reducing payments fixed in trading contracts, and extending the declines for paying trade fees. On 25th of March, President Putin announced following measures for micro enterprises, small and medium-sized businesses, deferring tax payments for the next 6 months, cutting the size of social security contributions in half, differing social security contributions, differing loan repayments for the next 6 months, a 6-month moratorium of fines, debt collections, and creditors' applications for bankruptcy of debtor enterprises. Additionally, a new tax on income from large deposits will be introduced in 2021, and the tax of offshores will be increased. On the 27th of March, the Association of Banks of Russia reported an increase of deposit closure. On the 25th of March, associations of companies of online shopping, retail, culinary, and 9 other industries sent a letter to new Prime Minister Mishustin, in which they warned of a possible collapse of their businesses and asked for numerous additional measures of support. On 26th of March, a petition signed by publishing houses and bookshops pleading for support was published. Aeroflot's low-cost carrier Pobeda Airlines announced it would stop flights on the 1st of April until 31 of May. Sberbank and VTB Bank, with backing from the central bank, will start offering 6-month interest-free loans to businesses to help them pay employee salaries. The Eurasian Economic Union will ban export of the onions, garlics, turnips, rye, rice, buckwheat, proso millets, groats, whole wheat flour, granules of cereal grain, pleat buckwheat grain, buckwheat ready meals, and so on, from 10th of April to 30th of June. About social impact. On the 5th of March, First Deputy Prime Minister Andrei Belousov announced cancelling St. Petersburg International Economic Forum, which was due to be held from the 3rd to the 6th of June of this year. On the 11th of March, Russian Defense Minister Sergei Shoigu cancelled the Moscow International Security Conference, which had been scheduled for the 22nd to 23rd of April. Yesterday's situation. President Vladimir Putin announced a new package of measures to support Russia's businesses hit by the economic fallout of the coronavirus pandemic. Moscovites began to complain of large queues outside metro station and severe traffic jams on the first day of the city's mandatory digital lockdown passes, prompting concern that the coronavirus could spread further. The Murmansk region will use electronic bracelets to monitor the movements of coronavirus patients self-isolating at home and people suspected of having the coronavirus. Also, the head of Moscow's main coronavirus hospital has recovered from the virus 2 weeks and after he tested positive. And today, Russian Veterans Association have asked President Putin to postpone Russia's annual Victory Days parade in Moscow, which is set for the 9th of May due to the coronavirus situation. This year's celebration mark the 75th anniversary of the Soviet victory over Nazi Germany. And also Russian officials denounced United States President Donald Trump's decision to cut Washington's funding to the World Health Organization, with Deputy Minister Sergei Ryabkov calling the move a very selfish approach and very disturbing. That's in brief the situation with coronavirus in Russia. We all now are at home and working also at home, but we are researchers. We can write our text and use Skype or Zoom for connecting with each other. Thank you very much. If you have questions, welcome.
Yes, sir, we'll have some questions from you, and it was a very nice brief which you gave, whatever is happening in Russia. Now we have another general with us, General Surisan. I assume that he's from Thailand. Sir, can you please, since you are for the first time with us, we would like you to please introduce yourself and also tell us what is happening in Thailand, sir.
So, good afternoon, everyone. It depends on where you are. In Thailand, it's about 2 p.m. For the one who haven't been working together, I am a retired general and working as the director of the Thai-Chinese Strategic Research Center of the National Research Council of Thailand. Yeah, we work closely for the research platform of exchanging the meeting and seminar, joint seminar, and also providing the knowledge about the relationship between Thai and China for the public and for the both countries. So in short, I think so far so good hearing from our friends, in particular from Brigadier Said. He gave me a lot of I think I'm very much improving Pakistan, and from the Sri Lanka is also a very good news and good sign. I can share in short also. So, let me say that in Thailand, we are quite lucky, and so far the number of the infected is about 2,600. 1 month ago, there was the what you call the foresight or the forecast that the midnight of April there would be 100,000 or 300,000 of infected in Thailand, but we can control that within 2,600 infected is good enough, and so far for the recover we have more than 700, and the death is 39, and for the new infected today, just already 29 new infected, and the new is like what our friends from Russia talked about, because Thailand has already been closing the airports and curfew to every province, but only at night from 10 p.m. to the 4 a.m. in the morning. And so far the government has launched the emergency law, but that is not so much strict, because the people who working in terms of transportation, in terms of food supply, would be able to go further for the online business, and there's so many things, and in particular for the nurse and a doctor who are working in the health, public health. The social, I can say the CSO, the social community has already been signed that they many social donation come to the poor, as you know, the Thai government issue every poor, every the people under poverty line. It's not much, but it's sufficient for a month to stay at home. And in particular, I can say that the delegation of authority to the community help a lot for the public health service, and also the so-called the immunity or the community immunity. And because Thailand is now quite hot, so the infected case was quite low, because so far we learned that over 27 degrees Celsius, the virus might not be able to stay. This is one of the good things. The other things that I would inspire you, that's the media. You said one of our friends talked about the media, Amigo, from Pakistan. Medias could create many areas of cooperation. The subject specialized, and also the tell the elite how the poor is affecting for that. In that case, the no fear of fear is in Thailand is now decreasing. Not so much the previously, but because of the culture of awareness and culture of preparedness was not so well. But today, I think we can control the infection quite very good. And another thing that the spring in other part of the world, I think, but would help. Hopefully that would help the people much better. To say that social distancing in Thailand, perhaps that is not unfamiliar with Thailand culture. Of course, we go back and forth for the family, particularly for the New Year of Thailand. That's the 2 days ago. That's the Thai New Year, where my family could not go back to my mom because we have to commit to the social distancing. But it helped a lot for clearing ourselves, for building the immunity of ourselves. Not the herd immunity, of course, but we try to make the things. So I think that is the what I want to share, that for Thai lockdown, lockdown the city. It does mean that we locked everybody, but we prepare even for the second round of infected also. And we have more than 190,000 doctors and nurses, and that would be enough or sufficient for engaging, helping the people, about 10,000, of course. So in this case, the facilities in Thailand, and just 2 days ago, we got a lot of good things with China, with the Chinese government, to create and to establish the labs between ASEAN and China, and also Thailand and China work quite close. So with any other friends, I think perhaps the new concern is quite the same for the economics. So what should help that Thailand launched quite many measures already, particularly for the SMEs to make them stronger on the online business, on the online education, and also from the the online healthcare. That would be one another thing that we can share later on. So that's it from my side in chat, but it's good enough to sitting beside you all and hearing from you all. So thank you, Khalid, for the, creating this platform. So wish you, all of you, all the best for this period of the difficulty of time. Thank you. Thank you.
Thank you very much, sir. And we also wish safety to the people in Thailand and to you also. Now we will go to Azerbaijan. From Azerbaijan, we have our friend Professor Babak Hosseini. He is the head of Great Azerbaijan Public Union Institute from Baku. Welcome, and please tell us the situation in Azerbaijan and what measures the Azerbaijan government is taking. Over to you.
Hello, Khalid. Thank you for organizing such a beautiful event, and I welcome all of you from Azerbaijan. And the first, I would like to give you information that right now we have 1,253 cases with 13 deaths, and I think it's quite okay, and we worked very hard. So I would like to give you information how and when it started in Azerbaijan. The first case with corona, it was in 28 February. And one day before this, Azerbaijan created the operational headquarters to control and monitor the problems related to virus. And from 2 March, educational and all of other educational related activities suspended in whole Azerbaijan. And same time in 12 March, the first person dead with corona in Azerbaijan. I'd like to give you very statistical information so that you have a info. And all gates from Azerbaijan to other countries and to Azerbaijan closed. Up to now, we don't use any flight from Azerbaijan and outside. Operational headquarters conducted very tough isolation things like wedding, mourning, mass gathering, theaters, almost all kind of public places are closed up to now. And on 19 March, President created decree to fight the results of epidemic related to economics and unemployment and other issues. And for this reason, $150 billion applied for this. And 20 March, from 20 March, all the masses and supermarkets closed for 1 month. Actually, we started nationwide quarantine from 31 March in Azerbaijan. April 2, Azerbaijan created the online system to let the Azerbaijani nationals to go out only with SMS system, so that when the person wants to go out, he have to inform with SMS to Minister of Internal Issues, and then he will get a message to get out. Otherwise, it's not possible. Almost all kind of public places are disinfected right now. And I would like to give you very important information that all the people are required to stay at home in private houses. Only with this online SMS they can get out. Restaurants, travel places, all are closed, and I think very tough measures are being taken already. The government thought that we can keep the quarantine until 20 April, but maybe we will need like 10 more days to tackle this problem. I think it's all the information I can give you from Azerbaijan, and any questions I will be open to answer you. Thank you very much.
Thank you very much, sir, for the comprehensive briefing by you. Now we would go to Saudi Arabia. In Saudi Arabia, we are joined by Dr. Shahzad Yaqub. Let me introduce you, Dr. Shahzad Yaqub. Dr. Shahzad Yaqub, once he was a student of medical, he studied in the Xinjiang Medical University in Urumqi, China. The Xinjiang Medical University in China is one of the lead universities which is doing research on COVID-19. And Dr. Shahzad Yaqub is presently working with the Ministry of Health in Saudi Arabia. He's based in Saudi Arabia. So Dr. Yaqub, please tell us the situation in Saudi Arabia, what Saudi Arabian government is doing, and also please tell us something about the research been happening in Xinjiang Medical University in Urumqi.
Assalamu alaikum, everyone. Good morning, good afternoon, good evening, wherever, in whichever part of the world you are. Greetings to all. I will just be very brief, very quick, because I have to go for duty also. So just let me start with the latest statistics in Saudi Arabia at this moment. There are almost more than 5,000 cases at this moment. And Saudi government are like controlling everything very efficiently. The exact number of cases is 5,862. Recovered 931, reported deaths till this time as we speak are 79. Saudi government have previous experience of MERS, and that's why they have managed things very efficiently. At present, the situation is in Mecca, Medina, and Riyadh. It's 24 hours lockdown. In the major cities, its lockdown is from 3 p.m. till 6 a.m. in the morning. But the thing is that food delivery, the most important thing, is available at till 10 p.m. in the night. And otherwise, the Ministry of Health and the government is also telling people not to go out until and unless there is a dire emergency, a medical emergency, let's say. So far, Alhamdulillah, here it's well under control, and the Saudi government is providing everything to the citizens and also providing cooperation internationally. Recently, last month, it aided China on the request of China, and that was a huge aid by one of the organization that is under the patronage of King Salman, His Highness, His Excellency, that is KS Relief Organization, and that prepared everything very fast. So let me give you brief, just few points. At this moment, all the international and domestic flights are suspended till further orders, and that's maybe up to till May 31st, as per my information I confirmed yesterday. So Saudi Airlines and the GACA and IATA, they are still working on it, but the flights are suspended till 31st of the May. So it means no Umrah and no, still far the Hajj is yet to be decided, but so far there is no people going for Umrah, not even locals, international people, all of them have been stopped. And that has been done with the consensus of religious leaders, and people are abiding by the law strictly. All the inter-Gulf countries movement has been stopped. There is nobody coming in, nobody going out. So far, there are more than 150,000 total cases, total people screened. 150,000. Screen mean tested, not just like checking fever or cough. Like tested. They have been tested on real PCR and all the latest facilities available. 500,000 travelers have been screened and tested. Most of the get-togethers, including everything like get-together in the home, like home private areas, or in the marriage halls, or in restaurants, hotels, mosques, everything has been stopped. And Saudi government specifically, they are giving financial aid. The most important thing that everybody and all the world is focused, that the monetary response of the different governments. So far, it has announced 1,300 billion US dollars aid to small and medium enterprises. At this moment, Saudi is under two kind of stress. The one is COVID-19, and the other is the oil prices. So at this moment, Saudi government is maintaining everything very well. In total, 70 billion Saudi riyals, that is almost 18.7 billion US dollars, has been announced as a package for the private sector. And this is the information I'm giving you from the authentic sources of Saudi government and also International Monetary Fund Organization. They have cut down, they have stopped the people specifically working in Ministry of Health. They have stopped or withheld, you can say, the loan payments or the bank credits that has been in due for people. They have stopped taking action on it, and they are giving grace period for people. In fact, they are not allowed, and they're giving this relief to local citizens and international people who are working here expects that to withhold their credits in the bank, and they are giving, and there are also incentives given to specifically people working in Ministry of Health, as I am part of that, so I can tell you better of that. The other thing is Saudi Arabian Monetary Authority has reduced its policy rates twice in the March, and they're still working on it. Has announced SAMA has announced 50 billion Saudi riyal, equivalent to 13.3 billion US dollars, package to support the private sector, especially the SMEs that I have mentioned. And the central bank is also covering up the fee for private sector stores and entities and supply chains. In health, at this moment, we have more than around 500 hospitals standby with 80,000 beds in total, and that is being surveillance and monitored every day, 24 hours a day and 7 days a week. We are working, in people in Ministry of Health are working around 24 hours. We have been given a schedule: 3 days duty, 2 days rest. The measurements, the measures which Saudi government and how efficiently they have managed this is because of their previous experience with MERS-CoV that started in 2013, and it is the same virus from the same family with the very similar signs, symptoms. We are still getting reports, some patients of that, but in my city where I'm located, it's called Hafrul Bath in Eastern Province. We have 0 cases here. We have no case. There was only 1 case that was discharged 2 days back home with full recovery. And Alhamdulillah, in my opinion, at this moment in my city is the safest place on the earth, Alhamdulillah. And that's all due to the extensive work and diligence of the Saudi government and the local government also. There are many things which I can go on, and it's a long list what the country, the government is doing for the people. But due to lack of time, I would just shorten up here, as most of you people have said the things about what your countries have been doing. That was input from my country, where I'm living at this moment. Most of the things has been transferred to digital platforms, like schools are closed, universities are closed, colleges are closed, so all of education is going online. You can order even medicine. People suffering from chronic medical problems, they don't need to go to hospital. They can just message on the WhatsApp and different social media platform to Ministry of Health, and their medicine is delivered within 6 to 12 hours at their doorsteps. There is a specific number for people for reporting or assessing themselves for coronavirus signs, symptoms. All the ministries in the kingdom, they are working hand to hand to control this virus, and so far, alhamdulillah, it is being controlled very well. In the end, I would like to thank all the participants and all the organizers for organizing such a international level conference, where webinar, to be exact, where we have where we came together to share the thoughts. And last thing that I would mention recently is His Excellency King Salman has specifically provided 10 million US dollars aid to WHO, when most of the countries are cutting down their aids to WHO for different reasons. So thank you all, and I would appreciate the questions at the end of the session. Assalamu alaikum.
Thank you very much, Shehzad. Everybody was keen to know whatever was happening in Saudi Arabia. You gave a very comprehensive review. Now, I would come back again to Pakistan. In Lahore with us is Dr. Mahmood Al Hassan. Let me introduce you Dr. Mahmood Al Hassan. He is part of the board of experts of our center, and he is also a very renowned scholar and geopolitical expert of this region. He is a regional expert of Eurasian countries. Over to Dr. Mahmood, sir.
Okay, thank you very much, sir, for giving me the time to express my expertise about the COVID-19, especially in our part of the world, and how China, being the second largest economy of the world, cope with the the ongoing COVID-19. So I would like to precisely mention the leadership or Chinese president crisis management model, which are based on the different aspects, parameters, policies, programs, in order to eradicate the COVID-19 in its country. So it is based on, firstly, and in simple words, identification, prevention, penetration, monitoring, and recovery. And in layman language, it is about listen, talk, engage, implement the different phases to successfully combat the ongoing COVID-19. So good thing is about the Chinese crisis model is that it is based on preemptive measures, centralized command, and one thing came for all the country to follow is the unity of command. When you have the unity of command in their countries, then it is very easy to combat any natural, financial, economic, or social crisis in their countries, because it is policy oriented towards the friendly sphere of life, interpretation, and functionality. Chinese health model has become the victor in terms of many different things. People, or especially Western media, has been blaming about the capacity building measures of China and the non-transparent manners to cope with the ongoing COVID-19. But being the expert of CPAC and BRI, I really appreciate the tireless efforts made by all the Chinese people, and especially the leadership of China, who made or who achieved a miracle in the current history that saved until now uh, so many unlimited lives from going to death, and showing towards that. And there was a a national consensus amongst the Chinese organization, departments, and even in the people's ethnic groups that we will win against the COVID-19. And there was a national-wide campaign, public awareness campaign, advertisement, advocacies, policies, reflection. Okay, if we win in Wuhan city, at the epicenter of COVID-19, we will win everywhere, and it was and it has happened. And the other thing is that human spirits never dies. China stands for its rich culture, traditions, innovative diplomatic or diplomacy policies, so has emerged as a hope for humanity, and for the sterling people, for the whole world, how to fight against the COVID-19. I would like to also say about the global humanitarian assistance of China to provide every possible facility to every needy country. Take the example of Pakistan, which has been receiving the Chinese humanitarian assistance after the outbreak of COVID-19, and almost more than 85% of international aid comes from China. That show the high level of bilateral relation, political understanding, and brotherhood between the two great nations. Take the example of China, who was the first to respond or reach the dying soul of Europe, Italy. China was the first to send its expert team of experts, doctors, nurses, medical staff, ventilator, and all other things to save the ill people of Italy, because Italy has the largest number of Chinese people living in Europe. And its Chinese global reach does not confine only to Europe. It has already started its humanitarian systems to Africa, which has already been ignored by all the international organization and so-called big superpower. But China is all there to help the African people from dying with the COVID-19. China was the first one to help out the Iran, Iraq, and all the Central Asian countries against the COVID-19. So, in other words, his foreign office, which has been under great criticism from the West, has been making bridges of trust, international cooperation, collaboration, and coordination to transpire the other international organizations and department and even communities about the ongoing integrated efforts taken by China. It has also started or initiated the online consultation mechanism, connected almost every country around the globe to give its suggestions to all the international audience, community centers, general masses, health organizations how to go against the COVID-19. In this case, China has published a booklet, a very brief booklet about its national response against COVID-19, which has 7 guidelines against COVID-19 about diagnosis and treatment, 6 guidelines relating to prevention and control, which has been published more than 150 international languages around the globe. So it is a international sport of the Chinese government to rescue, to help out the international communities against the COVID-19. In this regards, its private sector, mainly Alibaba Foundation, Jack Ma Foundation, and its other big multinational have been doing a great human service to all the struggling people, not its own country, but the ASEAN region, SAARC, EU, Central Asian countries, South Caucasus, and even Russia. Let me conclude that COVID-19 has changed the societies and, of course, the economic system around the globe. It has also changed our living styles and the human survival model. So we are going towards a new political or economic, socio-economic system where we can be dominated by the artificial intelligence technologies. And in order to cope all these emerging socio-economic, geopolitical, and geostrategic scenario in the near future, we have to be very cautious and preemptive in our national and regional strategies, so that to mitigate the socio-economic impact of its deadly disease. So to end, I just express that there is a need of economics, of new model of economics, new model of economic engagement, and new model of international correspondence and engagement and cooperation. So the one of the main thing or that should be and will be the part of our human survival on this planet is the institutionalization of economic of humanity, because through economics of humanity and charity, we will be in a better position, not having the tied or conditional sort of inflows of aid and trade. So in the past, we have already learned a bitter reality that through seeking international cooperation in terms of aid and financial assistance, there again came the international conditionalities, which badly suffered us in the past. So China stands for rich civilization, human values based on international cooperation, coordination, and collaboration. So in the last, I would like to say that CGSS has already started a very comprehensive international media coverage about the Chinese ongoing COVID-19 combat, especially National Herald Tribune, Al-Akhbar, and even the CGSS has produced a lot of qualitative articles, research papers in order to showcase the Chinese model to the rest of the world. Thank you.
Thank you very much, sir. It was indeed, you gave an overview of the regional situation as well as the Chinese model. Now, I would like to come to Pakistan again, and we have Mr. Amir Durrani with us. Mr. Amir Durrani is also a member of our advisory board, and he is a finance expert, and he is presently working with different government departments to work on the economic impact of COVID-19, not only in Pakistan but around the world. Mr. Amir Durrani, please.
Thank you very much, Khalid. First and foremost, my great kudos and my regards to all the panelists. I think that as far as what I have been listening to in terms of webinars, this has really covered a lot of ground from Sri Lanka to Thailand to Russia and back. And I think that all the panelists have made great points. I specifically would like to mention the complete lockdown by my friend from Azerbaijan, which I think emulates pretty much what's happening in UAE. I have two specific questions, if you allow me, Khalid Saab. They will be targeted, one at Professor Wenhong in China, and then there is a collective question, this is the first one, and the second one will be targeted to our dear friend, Professor Leonard in Russia. So my first question is that, and this is really something we are struggling with in Pakistan, and Professor Leonard, we found that you talked a lot about what President Putin and your Prime Minister have done in terms of supporting the small and medium enterprises. I am just would like to ask your opinion on exactly how you are targeting your small businesses, because we are really struggling with that in Pakistan. My second question, which is collective to both you, Professor Leonid, and to Professor Wenhong, and this is relating the mention of WHO funding and also the New World Order. Now, I saw the statement by the Russian government basically on the fact that condemning President Trump's withdrawal of support to WHO. I also heard from Professor Wenhong the mention about the fact that a new world order in option 2 and option 3. I would really like to posit the question that do we really find the UN, which is the post-Bretton Woods system, so efficient that we would all really want that when it crumbles because of natural reasons like this pandemic, that we would really want to bolster it up. I would in fact think that this is really the first opening of the global world order and to recreate the new global governance. I also would like you to comment on the fact why some are writing on the sidelines about a UN-led security force to become the global governance force. So I think these are my questions. Some of them are too blunt. I really apologize, but I thought such an erudite gathering as we have here today, maybe we should hear from both. Thank you.
Thank you very much, sir. Now we will go to Russia, to Professor Leonard, to ask him about this question. Professor Leonard.
Yes, thank you very much for your questions. For the first question about situation with small business, yes, it's rather bad, I should say, because all little organization, very little shops, taxi and other business structures, little business structures are closed in Russia, especially in Moscow, because I live in Moscow, I can see, and this small business loses much money every day, each day. And because Moscow is closed, now Moscow is closed till the end of April, and nobody knows how will it be closed on the end of April or not. Maybe this situation will last till the end of May, because I've said in my speech that veterans organizations asked president and government to postpone veteran parades and especially a parade on Red Square, and it should be on the 9th of May this year. And if so, I think it will last till the end of May and even June. And the situation with small and medium business will be very, very bad. Yes, in the last speech yesterday, President Putin said that some money will be given to people, but unfortunately not all people, not like in the United States or in Germany, for example, yes, but only, for example, for doctors and for people who work in medicine, yes, and there are people who are unemployment. They also will get some money. Yes, in Moscow, the amount of money will be the biggest, yes, than in other areas of Russia, because Moscow is the richest city in our country. Yes, it's so. And the situation, it's rather difficult. Yes, big supermarkets, yes, they work. Yes, we go to the supermarkets maybe 1 or 3 times a week, 3 times maybe a week, yes. But also yesterday in Moscow, they said, the government of Moscow said that to go to another, for example, part of the city, you should get a special ID, special pass. Yes, you can get it from internet sites, for example, or you can call to special telephone number, and they can ask special figures about this ID. Yes. As for me, I didn't get yet. That's why I can't say if it's good or not. But as I've said that yesterday, to our metro, to our underground stations, there were very big, a lot of people, because they are trying to enter the underground stations, and policemen, they ask them to show this ID, and that's why these people blocked enters for other people. Yes, that's the situation. This contemporary situation now in Russia, in Moscow, and our economists, a lot of economists say that it will be not rather good, yes, for Russia because of this situation, especially for small business, unfortunately. But this, because of fall down the prices of oil, yes, you know that Russia gets money, much money from oil, from selling oil. Yes, and also the situation is not good. And what about second question about, I maybe didn't hear well, could you repeat it?
Thank you very much, sir. The second question was basically was targeted to Professor Zhu Wenhong in China. Mr. Ahmed, can you repeat the second question?
Yes, Zdravstvuyte, Professor. My second question was around basically that you mentioned specifically, I mean, there was mention of President Putin and your Russian government generally supporting WHO and saying that by not supporting WHO from President Trump is a bad signal. I think actually WHO and the whole UN system, and my question to you, in the new global governance order, maybe this is good that WHO is not getting funding. Maybe it is good that the UN falls so that there can be discussion around a new global governance order, because this previous order is basically post-Second World War, what we call a Bretton Woods order.
Yes, I got I understood your question. Yes, it's rather long story about the new global order, about the maybe rebuilding maybe United Nations system. You see this situation after the collapse of the Soviet Union raised this story, about the situation with this United States and United Nations and United Nations system. You see, maybe it's possible, but it's rather maybe difficult that other countries will agree to all this reconstruction of the United Nations system, because we all know that five members of United Nations, that is Russia, China, United States, Great Britain, France. Yes, they should agree maybe between about this new global order, but now maybe it's not possible, because there are big I don't know. I forgot. Yes, between these countries, and also other countries, such big countries like India, Brasilia, should also, I think, take part in this new global order. South Africa, for example, yes, Japan, oh yeah, yes, and some European countries. And this is the big question, how to do that all these countries will agree to the changing this world, to the changing this the contemporary order, and to create the new order. Yes, maybe it will be possible, yes, after this situation ends. But you see, it's now everybody doesn't know how to do it and how to make this new order. But maybe it will be possible. I think that our leaders of our countries, I think, will begin talks about this situation. But I think also this pandemic of coronavirus, I think so. Yes.
Thank you very much, sir. Now our friend from Azerbaijan, Mr. Babek, also wants to comment that why developed countries are staying behind in providing economic support. Mr. Babek, please.
Dear all, I would like to state very important thing here. Why, for example, countries like us, we really stand by it, and we got less problem than other very developed countries, like European countries. For example, Italy, much more developed. There is very important thing that Mr. Mahmoud told it. It's very important to command line from the government to the last person of the country. You know, to stand and to go to get the orders directly on the line. It's very important, and we applied it in our country, even though we are not very developed than other European countries in healthcare system. Only good and very serious command line from the government to the last person can tackle this problem. I think we have tried it, and we have been more successful on this, with only certain people died up to date. Thank you very much. I wanted to state.
Thank you very much, sir. Now we will first go to Dr. Mahmood. He's a comment about what Dr. Leonard had said.
Question raised by Mr. Amir. So Russian government has already announced different financial packages, incentives, exemptions to its small and medium enterprises sector, not confined to tax exemptions, deferral of principal payment up to the next 6 months, waiver of markup amounts, and even the state guarantee for the job security, new job creation, and all these holistic policy of Russia is mitigating the bad effects of economy, especially on SME. And other aspects of the change of global governance, yes, it will be changed in terms of technological orientations. Bitcoin may be the order of the day in the years to come, and the rise and institutionalization of the artificial intelligence technology, to especially in the health program. And we all know that our global system is based on power politics. So power politics may not be lessons in the days to come, but it will be regrouped or redesigned. So in the end, I would like to say some good things about all the international experts giving their valuable inputs about their national policy responses and integrated program to COVID-19. So let's start with our
Thank you very much,
professor.
sir. Thank you, sir. Thank you very much. Now I would like to go to Brigadier Akhtar Nawaz Janjua. Brigadier Akhtar Nawaz Janjua is a senior member of our advisory board, and Brigadier Akhtar Nawaz Janjua also represents our think tank in Shanghai Cooperation Organization. He is an expert on the region, and he's a personal friend of Professor Zhu Hong also.
Thank you, Khalid. It's been wonderful to see people from all over the world talking about the pandemic and the measures adopted by their respective countries. We here in Pakistan can learn a lot, and I could see the face of Professor Van Hang. He really is a personal friend. He's been very kind whenever one has been to Beijing, and whenever he comes here, he ensures that he sees me. And I think from Russia to China, Azerbaijan, Sri Lanka, Thailand, Saudi Arabia, it seems that we all are on one page to combat this pandemic in the best possible ways. And one could find the gentleman from Russia saying that Moscow, the businesses are closed. Same is the case here. And one was reading that there are a lot of people being laid down from the businesses in the US also. So this is a concern for the world, and the world should fight on. And I think there was a question by Mr. Amir that cutting off the aid of the WHO. I think somebody might, I missed that, somebody might have actually spoken on that. But there is a concern, this is the time not to cut the aids for the health sector anywhere in the world, individually on the countryside and internationally also to the international organization, if we have to fight this pandemic. Khalid, thank you very much.
Very much, sir. Now we move over to the next question. I would like to invite Dr. Bisharat. Dr. Bisharat is basically a public health expert. He would like to ask a question from the panelists. Dr. Bisharat.
My questions are to the international experts from Sweden, from Russia and China. I would like to ask them that in Pakistan, we have a partial lockdown, not full lockdown. We have allowed the construction industry to start work. As you know, with the construction industry, there are 65 allied industries which will also start working. And we also allow, the food industry, the health industry, and the defense industry to work. So what would be the effect of this partial lockdown? Would it work, or we need a full lockdown? Number one. My second question is, other countries are supporting middle class in this pandemic. Like the Canadians are giving about $2,000 to each taxpayer. And the Americans have recently given about $1,200 per month to its taxpayers, even if they are foreigners. working in America, they are giving to the middle class Americans and foreigners $1,200 and so on. Whereas in Pakistan, we have only given relief to the lower class, the laborers, and the very, very rich, the businessmen, the industrialists. They have been given subsidies and bailouts, whereas the middle class has been ignored. So what could be your suggestions for that? My third question is, would the international participants like to share the guidelines which their country have for lockups? That will help Pakistan to develop its own guidelines as well. And the fourth and last question is, how we can effectively implement the lockdown? Thank you.
Thank you very much, sir. First of all, for these answers, I would like to go to China. Professor Zhu, are you there?
Yes, yes.
Yes, Professor Zhu, if you can answer the question regarding the construction industry, because in Pakistan, our Prime Minister just yesterday opened the construction industry because we feel that the construction industry can stimulate the economy, and also the measures for effective lockdown. So first we will ask Professor Zhu, and then we will go to Turkey and ask Madam about the experience of Turkey.
Okay, actually, you asked me two questions. First is talking about the construction industry. Second is about the lockdown policy. Thirdly, I would add some comments on the world order, just like previous speaker talked about this. I would like to talk about something about this. Global order, world order. First, construction industry this time. Just I got the news from last night from the CCTV news. I got that the construction industry developed from the March 2020. It already started to recover. It already recovered very quickly. Also, at the same time, the government at all levels around China make some big projects to recover the economy. So, totally in 2020, in the whole year, I don't think the construction industry will have a loss. Despite all the current situations, I believe the construction industry will have a good development in this year and next year, just like the 1930s in the New Deal in the US. The government with many big projects will help the construction industry will make some recoveries. That's my answer for the first question about the construction industry. And about the lockdown policy. The lockdown policy, actually, lockdown policy started on January 23. January 23. At that time, the city of Wuhan, the whole city was locked. And from that moment till this time, already nearly 3 months, almost the whole country, whole China, in the quarantine, in the lockdown policy. But now this time, as you may notice, that new cases around China have becoming less and less, and some also the new cases are focused on in some new cases just for in some special province and special cities, just like in Guangdong, in Jiangsu, Shandong, and other provinces. Can you hear me, Khalid? Hello?
Yes, Professor. Yes, we all are hearing you. We all are hearing you.
Okay. Just in several cities and several provinces, but in the province and in the cities where there are no new cases, all these cities, all this province, they are step by step get recovered to go back to work, and the lockdown policy becoming easy. So I believe that started from the May, the whole country become much more easier in the according with the lockdown policy. And in China, I believe that the COVID-19 pandemic situation will be much easier and full under the control in the coming months. The pandemic will not, although in some cities, some provinces will have some new cases, but the pandemic will not continue to influence the economic development in China. That's my my answers to the second question about the lockdown policy. As about the world order, I would say such comments. First, about the world order, I would like to divide it into two parts. First is the world political order or global political order. As you know well, that just because of the Trump administration is incompetent, the leadership of the U.S. is too weak. But the U.S. is doing all what they can do to keep the U.S.'s leadership. But U.S. used the leadership, global leadership, only not in the right way, not in the right direction. At the same time, China does not seek for the self-dominance of the world. China does not seek for the leadership over the world. At the same time, other countries like EU, like Russia, Japan, and also other countries are not ready for the global leadership. Also, it is obvious the world order will face, the world order will never be just as before the COVID-19. COVID-19 pandemic is obviously a turning point in the global history. The trend of polarization will go further. The world order will face more turbulence. The second is the world economic order. As you may notice that just in the fighting against the COVID-19, U.S. has an unlimited QE policy to support the U.S. stock market. Such an unlimited QE policy is at the loss of global economy, at the losses of all the holders of the U.S. dollars. The purchasing power of all the U.S. dollar holders has becoming weaker. So this time, the trend of their dollarization is become more stronger. I don't think in the future, the U.S. dollar still will keep its dominant status in the international financial orders, and also in the coming years, multi-currency system will be more realized, more real lies the situation in the future. That's my comment. Khalid, thank you.
Thank you very much, sir. So I would now like to go to Jal Jafri, and because since our time is now almost over, sir, can you kindly please give your concluding remarks and thank all our honorable speakers from across the world.
Yes, okay. Thank you, Khalid. It has indeed been a very informative and a very interesting interaction, having learned the views and the methods adopted in various countries. I'm sure we are carrying a lot of suggestions which we can give to our own government also. This interaction has been very beneficial, and I'm sure we will continue with this interaction. Just a few points from my side. First of all, Professor Zhu, I think his analysis is quite right when he says that the global order has already started to change. It has already started to change. I would just like to ask him, in short, how does he visualize the new world order? Very briefly, what are going to be the power centers, and how is this going to unfold? This is number one. Number two, a lot is being said about the cutting off of aid of WHO and the reorganization of the United Nations. While there is no doubt that the UN has to be reorganized, there are a lot of areas in which this can be done. But cutting off the aid to WHO at this time is being questioned by a lot of people. And probably this could have been done maybe later, or after having analyzed the situation. However, there were various reasons why this was done by the US. The reorganization of the United Nations has been debated for a very long time. We must remember that it took the First World War to create the League of Nations. It took the Second World War to create the United Nations. And now we have to see if COVID-19 will be the catalyst for the creation of a new organization or for the reorganization of the UN. So having said that, I will again refer to Professor Zhu about his concept of the world order. Very briefly, Professor, as we don't have time. Thank you.
Thank you. Thank you. Okay, thank you. Just as I mentioned before, that the US will be becoming weaker and weaker, just because the Donald Trump as administration is incompetent. The leadership of the US is becoming weaker and weaker. Although US wants to keep its dominance, its global leadership, they want to doing all what they can do to keep the leadership global, but they cannot. Also, they use the global leadership not in the right direction, not in the right way. So many people, many countries are not satisfied with this. That's the first point. The second point is China does not seek for the global leadership, at least by this time. China does not seek for the global leadership, but at least by this time. But at the same time, other countries like EU, like Russia, like Germany, like Japan, like Brazil, like South Africa, like Egypt, they are not ready for the global leadership. It obviously the global order, the world order will never be the same just as before the COVID-19. As I mentioned, COVID-19 is a turning point in the global history. In future, I can predict the world order will be such a pattern. Will be such a pattern. One superpower. That means one superpower that U.S. will still be a global superpower, keep some global leadership, but not full, not as before the COVID-19. But at the same time, China, EU, Russia will become regional powers. So the global leadership will be such a pattern, just one superpower, several regional powers. Just under such a pattern, the world order will face more turbulence. The regional uncertainties will definitely increase. This is in the global political orders, also in the global world economic order. Just because of the U.S. unlimited QE policy to support the U.S. stock market, U.S. dollar lost its strength. U.S. dollar will become weaker and weaker, and EU, euro and Chinese RMB maybe will play a more important in world economic order. So this time, okay, that's all. Just stop here.
I must thank all the participants who have taken part and spared their time to to get together and try to assess the situation. So thank you once again from my side and from the CGSS.